A brand new VA Inspector General audit just revealed something absolutely shocking, or maybe not so shocking if you've been paying attention. All 139 VA medical centers are facing severe staffing shortages. I'm going to go over what that means for us, the ramifications, and the impacts on us as veterans. Okay. We're talking about psychiatrists, we're talking about primary care doctors, we're talking about the very people that you and I rely on for life saving care, and that is bullcrap. And here's the kicker, this is happening in the middle of VA massive workforce cuts. And guess who's on the losing end? Us as veterans. Is that fair to me and you? No, but me and you chose to serve, right? These are the benefits, the health care that we raised our right hand to get. Why are we getting put on the back burner? Because the ones on the chopping block are me and you. This is not fair at all. Let's break this down, okay? The report says critical roles, mental health providers, primary care physicians, even specialty care doctors are getting unfilled, right? These aren't minor gaps, these are major gaps, right? These are positions that directly affect how fast a veteran like me or you can get an appointment, refill a prescription, or get evaluated for a service connected condition. Okay. And if you've been tracking some of the VA policy lately and been up to date on the news, you know that this is not random, right? It's garbage. The VA has set a target to cut nearly 30,000 positions by the end of fiscal year 2025. How? How are they going to end up doing that? Through hiring freezes, right? And attrition. Okay. Translation, right? Let me put it to you like this: when people quit or retire, they're not replacing them. Okay, let me say that again. When people quit or retire, they're not replacing them. They're not doing it. This isn't just a budget story, it's a healthcare crisis, and it's sad. Listen, I went to my primary care doctor to go get treatment, and I couldn't even spit out everything that I had going on. Even though I got delayed in getting the care, I had to go to another VA facility to get the treatment that I needed. And I had to spit out, I couldn't even get everything that I needed to get out because I was out of time, because there's a staffing shortage, right? This was not even a registered nurse. This was someone helping, and just, hey, what do you got going on? What's going on with you? Tell me what you got going on. Okay, I'm going to put it in. I'm going to put in these consults. All right, get on out of here. Next, right? See, what happens is whenever there's not enough staff to take care of the amount of veterans, right? Then guess what? Guess who doesn't get the help that they need? Me and you, the veteran. The veteran does not, right? So who's going to take care of that, right? But it's no problem to go for 20 plus years of war and to run people into that, and people dead, and 10 feet deep in the ground, and wives not here, husbands not here coming home to their family, wives not here coming home to their family, men and women, sons and daughters who raise their right hand, but we can't even get the care that we need. That's garbage. It's garbage. Now let's put some real faces to this, okay? Let me give you a real life example here, not just a bunch of garbage, okay? There is a veteran that is struggling with PTSD. Number one, he's a Vietnam veteran, and he never got the help that he deserved. He was never given any sort of help. He was never even given help while he was in, right? Yet he transported, he handled dead bodies, he was around Agent Orange, all types of stuff. And he went years dealing, living, sleeping, waking up, going through the battle internally and sucking it up and dealing with it. And whenever he came back, he got spat on, right? He got told that he was a baby killer, right? Never got the proper help, filed his claim. Nobody ever told him that he needed a nexus letter, or that he needed a disability benefits questionnaire, or the arsenal that he could have in his toolbox to win his claim, right? But guess what? He finally decided to get help. Thank God he didn't give up, right? But imagine that veteran there. I know you're out there that's struggling with PTSD. You finally decide to get some help. You're tired of sucking it up and dealing with it. You call your local VA clinic, and the earliest appointment with a psychiatrist is a minimum of 3 months away. And imagine this: you wallop down into the VSO's office, and they just throw your claim up there. They just throw mud at a wall and stuff. They just throw your crap at a wall and it doesn't even stick at all, right? Then the VA comes back and says, oh, you got to have continuity of care. You need to get, you didn't have any treatment. You were never diagnosed. And the veteran's going, what in the world? I was in combat. What are you talking about? Right? They don't give them anything or any sort of help. This is what a lot of veterans are facing. Why? Because I help them out every single day. Every single day, people who are not getting help, who are not being taught the playbook at all. And it's not right, right? Why does it got to be a mystery to figure out these benefits, And oh, let me add the icing on the cake as well, too. Let's cut the healthcare for them as well, too. Let's cut the healthcare. Let's screw with our veterans and cut the healthcare. Garbage. Maybe you've got a heart condition tied to your service. Your primary care doctor leaves, okay? These are real life stories and the VA doesn't replace them. Suddenly you're seeing a rotating cast of providers who have no idea about your history. Anybody know that story all too well, right? They don't know your service record or your medications. And then you find yourself on repeat like a broken record, telling them over and over and over again what you've done told 50 million other people, right? That's the reality right now for thousands of veterans. And with these cuts, it's about to get worse. I'm afraid it's about to get worse. And I'm not here. This channel ain't here for fear and stuff. It's the reality of what's stinking happening. And I think it's garbage. Our veterans, you listening, we deserve better. So here is my big question. Why is this happening? Why is this happening? Why aren't there other areas that we can attack to cut? The official answer is this: money. It's all about the Benjamins, cost savings. The VA says trimming the workforce will improve efficiency. Oh my, all right. There's a lot of freaking mistakes happening, right? They're saying that it'll streamline operations. Okay. But here's here's what's critical, right? Including veteran advocates and unions are saying, right? Here's what the critics are saying as well. This is penny pitching at the expense of those who've already paid the highest price. You. Since 2017, the VA has already lost thousands of core medical staff, nurses, doctors, psychologists, you name it, they're gone. They're not here anymore. And with the recent termination of most VA union contracts, guess what's happening? Morale, you can kick that down the gutter because it's sinking even lower, right? So let me talk about the ramifications of this. Let's talk about the domino and the ripple effect, right? What does fewer staff means? Longer wait time for appointments for me and for you. What does this mean? Delays in claim-related medical evaluations. What else does it mean? Increased burnout among the providers who are still there because somebody's got to do the job. Somebody's got to get the work done, right? More veterans are pushed into community care, which isn't always faster or better. Great that you gave us 12-month authorizations to community care. Great. But why don't you give us the best care that we can possibly get? Why are we always attacking the veteran benefits, the ones who said, yes, I will serve this country and defend this country? And for programs like the PACT Act, which already have high demand from toxic exposure claims, guess what this could mean? Serious bottlenecks, serious roadblocks in getting the care that you and I were promised, okay? So what's next? Here's what's next for you. Here's what I think, right? We're going to see more veterans turning to Congress, more veteran service organizations to demand staffing protections. We should. We're going to see a push for legislation to keep critical medical positions fully staffed, which we should, no matter what budget cuts happen elsewhere. And unfortunately, we're likely to hear more stories of delayed care, missed diagnoses, burnout among VA employees until this staffing crisis is addressed. We're looking at more people not getting the benefits that they raised their right hand and deserve. We're looking at more delays, more jacked up decisions, more evidence not considered, more greenhorns adjudicating claims, people just coming in that don't know what they're doing, that don't know the 38 Code of Federal Regulations from a hole in the wall, trying to adjudicate stuff. It's garbage, right? So if you're a veteran listening right now, I want to, and if you're already feeling these cuts, I hope you're not, but if it is you, here's what you can do. Document every delay in your care, dates, times, names. Document, 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 right? Reach out to your congressional representatives and tell them your story. Let them know what is going on. Reach out to your congressional representatives. Stay connected, right? Stay connected with your local veterans organizations, VSOs, DAV, VFW, American Legion, right? Be on the front lines, be proactive, not reactive, right? Be on the front lines with those of us that are fighting to keep VA care strong, right? This isn't just a headline or anything. This is the future of healthcare that we're talking about that's on the line, right? And we're going to keep talking about it. We're not going to stop because staying silent is not an option. We've got to be proactive and reactive. And it's really frustrating, right? If you find this helpful, share this out with someone that can use this information. Share it with another veteran. Let's keep this conversation going. If you've dealt with this, comment below. Put your name. If this has been you, put your name down here. Put your service in here. Speak up about it. Absolutely. It is not time for us to just sit still and to lay back. It's garbage. It is garbage. It is garbage. It definitely is. We deserve better care. So listen, the one thing I want to encourage you to do is to not give up. I want to encourage you to continue to stay in the fight, continue to get the help that you need, right? But this is a reality that the workforce cuts and healthcare impact are significant, and there are huge ramifications for me and you as veterans, but keep on going. I want to answer a couple of questions right now. Johnny Ray says, my pain doctor, she talked to me and set up an appointment with me within 7 days. She didn't say another doctor would take over. I got an email. She's gone. Now I got a new doctor. I asked why. Exactly. It's what's happening. It's what's happening. Or you're being rushed through and you've got real life issues from your time in service that's going on. And who the heck do you talk to and address them with, right? Get help outside if you need to just keep things documented. It's very, very, very important. So again, this is really what's going on right now within the VA. A lot of workforce cuts and healthcare impact, right? Because of the almighty dollar. But guess what? It's coming at the cost of me and you. And I think that that's garbage. If you think that it's garbage too, share your story below, share it in the comments, share this out, like, subscribe, comment, hit that notification bell, share this out with someone that can use this information. Stay in the fight, stay in the know, keep going. Don't give up, document everything, reach out to your congressman, stay in the fight. Okay. So I just want to encourage you with that. I hope that this has helped you. Until next time, I'm out. Peace.